extensive issue. And if we jump down to the best report, it's still a third, 29%, almost a third. So even the people doing public health and preventive medicine that have the lowest reported rate of burnout, it's still almost a third. Again, it's pretty significant. So they divided it also up into generations. The millennials, Generation X, and the boomers. I always tease with Felix because he's a millennial and I'm more of a Gen Xer. And I said in this particular study, we're the best, which means we're the worst. And the millennials seem to be having the easiest time adjusting, but we'll talk a little bit more about that. So Generation X, 48% of the people fitting that generational category have reported burnout. The boomers, 39%, and the millennials, 38%. So again, we're looking at half.
Question.
Yes?
Considering those of us who are boomers have been around for a long time and the millennials have been out for a short period of time, doesn't the fact that they're almost as burned out as us old guys kind of raise a red flag? I mean,
Absolutely. And in fact, on the drive down, I was talking with Felix about that, and he made that point too. He said, you know, we haven't been around that long, and yet we're still at 38%. So you're absolutely right. So we can also break it down by gender, and 40% of women who were part of the study reported burnout, as opposed to 37% of men. So one of the other questions we talked about in reviewing this study is, are these numbers actually accurate, or is it that women sometimes feel more comfortable reporting those issues than men do? I don't have an answer to that question, but I think it's worth thinking about. So what contributes most to burnout? Number one, 55% say too many bureaucratic tasks, paperwork, charting. And if you look down to increasing computerization in EHRs, that accounts for 30%. I think if you put those two things together, because they're so closely related, that's where more than half of our issues are going to lie. Things, as we all know, have gotten much more difficult with regards to paperwork and charting. I have a private clinic that I meet a couple times a week, and just the volume of prior authorizations that we get for medications that I write keeps a full-time employee busy, and I only have that clinic twice a week. So that combined with the EHR requirements and the different reporting requirements now certainly can add to a feeling of overwhelm and drain, distress. Something else that I noticed too, if you look down, what contributes most to burnout, lack of control or autonomy is around 24%. My guess would be that that number is actually higher. Again, I don't have the exact numbers, but I would think based on what we've learned from human resources studies with corporations and large companies, quite often loss of autonomy or not feeling like the job is yours to control or is appreciated will contribute to work dissatisfaction. My guess is it's going to be the same in the field of medicine as well. And then they broke it down again by generations. If you notice, too many bureaucratic tasks, charting and paperwork is number one for all three generational divides. 57% for the millennials, 56% for Generation X, and 54% for the baby boomers. Okay, so we've got an idea of the extent of the problem. It's probably around 50% of the population that was part of the study. But how serious is the problem? What is the extent? How do we try and rate that problem? And that's what the next part of the study does. How severe is the burnout? If you look down where it says strong, severe impact on my life, That's 36%, 46%, and 50% for boomers. So when we ask the people in the study to grade the extent that this burnout is affecting their lives, that's the highest group, the highest numbers. And for boomers, it's again half, 50%. And I think you're probably right too, the 36% having a severe effect for millennials who, again, haven't been doing it as long as the rest of us. That's significant. Has burnout affected your relationships? 77% of millennials reported yes. 73% of Generation X. 69% of boomers. And again, I think that 69% for the boomers is probably actually higher. I just think that that particular group is probably the most reticent to report things like this and to answer any affirmative.
And what's the size of each group?
The size of the breakdown from one to the other?
How many are boomers? How many are millennials? How many doctors are there in Generation X? Do you have that number?
Yes, sir. If you look in the handout on page 28, it divides it down for you. 23% were millennials out of the 15,000 that participated. 35% age 40 to 54, and 41% 55 to 73. And then it also breaks it down by 38% women and men. And the very last page, page 29, breaks it down by specialty for you too. Okay, so how do we cope with the burnout? And this is where I think we can probably make the most difference moving forward. If you look at the first line, isolate myself from others, is 45%. Drink alcohol is 24%, binge eating is 20%, marijuana 3%, use prescription drugs 2%. I can tell you that the alcohol and drug use is higher than that, based on empirical evidence having worked for the Healthcare Professionals Foundation. The rate of addiction in the field of medicine, and I'm including physicians, dentists, dental hygienists, PAs, paraprofessionals as well, is around 15%. So as physicians, we're pretty good at taking care of other people, but when we have issues of ourselves, with regards to ourselves, we tend to just isolate from others. I think we learned that in our training. Okay, it breaks it down into generational divides, and this was actually my favorite one. The millennials go to sleep. They have burnout, and they decide how are they going to cope with it. They take a nap. Exercise, Generation X, that's good. And again, isolation, if you see, is a problem both with Gen X and the boomers. We don't, there's a certain, I guess, stigma associated with talking about burnout, talking about depression, talking about substance use disorders, especially in the medical field, which is something we can address and make better. So then they started asking questions in the survey about how could we make it better? What would you accept as a physician to try and make your burnout less egregious and to try and make your job satisfaction higher? So the first thing we started talking about is money. Would you take a salary reduction to have a better work-life balance? 52% of the millennials said yes. 48% of the Gen X and 49% of boomers. So again, we're right around half. So now we've established it's an extensive problem affecting about 50% of our population. Of that, up to 50% of the people think it's a very serious problem and impacts their lives. And now we're back to half of that population says they'd be willing to take a salary cut in order to make things better. And we're going to talk a little bit more about that as we go forward. Breakdown for men and women, 53% reported yes, they would take a salary cut and have a better work-life balance. And 47% of them responded. And then we got more specific. how much pay would you give up in order to have 20% fewer work hours? And again, this doesn't address the issues with paperwork, it doesn't address the issues with EHRs, it doesn't address the issues with insurance companies and reporting and trying to get compensated for the work that you do. It's just basically straight across the board, a 20% salary cut. And interestingly, largest group is the $10,000 to $20,000 group. So about 36%, about a third of each generational divide would be willing to take a $20,000 a year cut in pay in order to have less work hours, which is pretty significant. Do you have any questions? Okay. Where are physicians most burned out? And by where, we mean in what type of environment are they working? 48% in healthcare organizations. Outpatient clinics only 45%. Office-based multi-specialty group practices 44%. And interestingly, the office-based solo practice was only 36%. It was one of the lowest rates. And I think that probably has a lot to do with the autonomy we talked about earlier. That's the same thing we found in corporations with human resources studies is the more autonomy a person has, the greater their job satisfaction usually is. So then they started to try and determine which specialties and which groups of physicians have the best work-life balance and therefore the happiest. And primary care, 54% reported themselves as being happy. And in specialty, subspecialty practice, it was 60%, which I was a little surprised about. But that actually was borne out in some of the other studies I looked at as well. And then again, we got a third that say they're unhappy. Period. And then they divided up by generations, and the millennials seem to be the happiest. They're also the ones that take the naps when everything's getting bad, so I think that probably goes hand in hand. But again, if you look down, unhappy, you're at about a third of each generational divide. That is significant. And then they asked questions in the survey regarding depression. They found millennials, 15% of the millennials reported depression at some point in the last 12 months. In Generation X, it was 18%, and Boomers, it was 16%. I think they could have worded some of these questions with regards to the survey data, because the question just focused on the last 12 months. And I think if they had gone back further, say the last 5 years, I think the number of reported yeses would have been higher. And then since one of the purposes of this study was to try and get an idea of physician suicide rates and how that problem is part of our burnout, part of our impairment issues, health issues we grew up. They asked them directly, in the last 12 months, have you considered suicide or have you attempted suicide? And if you look, 23%, 22%, 23% men, 22% of women, only 1 to 2% actually had an attempt, but again, that was in the last year. 67% or 2/3 said no, they have not considered. And then again, they broke it up into generational divides. 68% of the millennials said no, they had never thought of suicide or attempted suicide. 65% of the Generation X and 67% of the Boomers. So those actually are good numbers. Better than I expected from the rest of the study, actually. And I thought this was one of the most telling parts of the study. Who did you tell about your thoughts of suicide? So if you look down where it says no one, that is the majority in every generation. So again, I think that's a reflection of our training and what we've been trained to do. We tend not to talk about our own health. We tend not to confide in others or seek care when we need to. while we're busy taking care of everyone else. Then they tried to kind of get an idea of how the depression, how serious was the depression. They did the same thing with the depression as they did with the thoughts of suicide and the other issues, the burnout issues. You know, is this a serious problem that's impacting your relationship with patients? And if you look, I am easily exasperated with patients. 39% of millennials, 38% of Generation X, and 34% of boomers. I think those numbers are fairly significant. That's, again, we're looking at a third of people who report. And in keeping with our idea of us not taking care of ourselves, if you look, do you plan to seek help for your burnout or your depression? 61%, 64%, and 63% on the generation said no. I've not sought care. Again, we're good at taking care of others, but we don't take care of ourselves very well. Does your workplace offer a program to reduce stress or burnout? 37% no, 50% no, 57% no. That's, I think, where we can make a difference. If we can bring awareness to this issue, address it, bring it out into the open, then we can devise programs to help and assist. And hopefully by doing that, we can avoid some of the sequelae that follows when people get to a point of burnout and considering suicide. A lot of times that is the use of alcohol, drugs, mood-altering substances to try and deal with the burnout. If we can get a program in place that deals with it before it becomes an impairment issue, well, that would be fantastic. Then we would have less people in our program, so that's okay. It'd be nice to have nobody in our program, to not have the need, but unfortunately, this is a pretty strong need now. How likely would you be to participate in the program if your employer had one? Well, that's the other thing we have to address. Once we bring these subjects out and start talking about them and we destigmatize them, I think those numbers will go up. I think it will be more likely that once it is acceptable to seek help, to talk to others about the issues, that I think more people will in fact ask for help and utilize the programs. That's my hope anyway. And they did the same thing, same quantification with the depression as they did with the burnout. And they found pretty much the same numbers. About a third of people said that the depression that they experienced in the last 12 months was significant enough to cause them to change the way they interact with patients. Okay, and that brings us to the survey demographics, which we answered earlier, breakdown by age and gender, and then the last part is by specialty. So at this point, I'd like to just open it up for a discussion. I can start by telling you a little bit about what my program does. The Healthcare Professionals Foundation of Louisiana, we are available to help physicians or healthcare professionals with any types of impairments that they may experience. We include substance use disorders as well as neurocognitive impairment, health issues, burnout issues, depression. We have 400 participants currently, which is a little bit more than we've ever had before. I have senior case manager Felix Vander is with me. He's going to talk to you all a little bit at the end and tell you what we do. Basically, we're here to help. We are a nonprofit organization, so we are funded by licensure fees from the state, and we're here to help physicians or any healthcare professional who need it. Questions? Yes, sir.
Did everybody remain anonymous in your gathering of information?
Yes. Yes, sir.
Did you stratify the causes of burnout? In other words, would the burnout for the boomers be perhaps have different causation than the millennial burnouts? Or did you?
Yeah, actually, the study tried to do that. If we look, top three contributors to burnout by generation, the millennials, it was the paperwork. Well, actually, for all three groups, the paperwork was number one. But spending too many hours at work and lack of respect for the administrators, employers, colleagues, and staff were the other two. Those are the top three for millennials. For Generation X, same thing, only lack of respect and too many hours was flipped to second and third. And the last one, for the boomers, the increasing computerization seemed to be a bigger problem for that group, which makes sense. The millennials have been exposed to the computer system, digital life for a lot longer than the boomers have. Yes?
So since so many more people are employed now and not in private practice, so what was the percentage of that in your survey?
The percentage of
Or
employee positions?
employee positions versus private
Let me
practitioners?
see if they address that for us.
Private.
Actually, I don't think they teased that out. I have to go back and look at the study and see. They broke it down by specialty, they broke it down by age. I would suspect that it is in the data, I just don't have it available, but I'll have to go back and look. Yes, sir.
I may have missed that, but are you associated with licensing boards and you work with the
No, we are, the Healthcare Professionals Foundation is a 501c3 nonprofit organization. We work, we have contracts to provide a service to the Louisiana State Board of Medical Examiners and all their licensees, to the Louisiana State Board of Dentistry and all of their licensees, to the State Board of Nutrition and Dietetics, to the State Board of Speech and Audiology.
So
Wendy?